I'm Dr. Marie McCormick, and I'm a family medicine physician in Reno, Nevada, and I'm also the division chief for Renown Health for their primary care division.
I'm not in medicine. I work in heavy industry. I do management consulting for various industries.
Let's jump into it. You know, this is a highlight for us, as I mentioned, a unique opportunity to hear from the voice of our participants. Today is exceptionally unique because we have a participant, a spouse, and a provider. So we have lots of faces of how MOBE shows up.
Here's the thing for me. I spend a lot of time talking with my patients, and many of my patients have become my friends. And one time a friend she was rushing out of the room, and she has the big three, like most Americans: high blood pressure, high cholesterol, and diabetes. And so then I called her later and I said, gosh, you didn't even give me a hug before you left. Why were you rushing out of the room? She said, I was trying to get to the car to my pad so I could write down everything you said, or as much as I could remember. So at first that told me, number one, I'm trying to cover too much. But number two, the thing that if people would take advantage of this, it's like having your health coach in your pocket. But I only get maybe, 20 minutes every 3 months with them. To take advantage of MOBE, you could have somebody call you every week until you totally understand what you need to understand.
The big thing that Marjorie brings to the table for me, and I'm surrounded with medical advice. I'm married to a medical doctor who's got years and years of experience, and then Dr. Koss, my personal family practice doc. She's real knowledgeable, same type of thing, tons of experience. Even though I'm surrounded by that kind of advice, you don't necessarily talk about it every day or every week or even every month. Sometimes there's some issues that either one of those two people, my wife or doctor, could address. We've been doing it for so long, you kind of stop thinking about what you're not thinking about. And then when Marjorie sits down and says, hey, let's go over some basics and let's talk about this, somebody's taking a fresh look at it. And then the timing of building on it every week or every other week was helpful, because you could learn a little bit, try it, and then touch back and take the next step. And Dr. Koss, my doctor, I'm not seeing her every 2 weeks or every week. So progress happening on a regular basis like that is something that I found to be good and helpful.
Well, what was that tipping point that said, hey, maybe I should give this a shot?
We got the box showed up, and I saw it, and I said to my lovely wife, I said, what's this? And she said, it's good, do it.